I started off in the MICU, which can be very daunting, kind of coming in. And for me, I spent my last few rotations being virtual, so due to the whole COVID pandemic, and so I hadn't really seen a patient for around 6 months. So it was difficult, kind of realizing that these are complex patients, and you kind of have to come in, and there's some transition, but first day you're putting in orders, writing notes, but it's great to realize that first day you're coming in and you're introducing yourself, and you say that you're part of the KU Otolaryngology program, and everybody has these kind of high expectations of us due to the kind of quality of people that come through the MICU and rotated there. And it's nice to know that that's how they view our program and view our department and other specialties, and through the same train of thought, you kind of set a higher expectations for yourself, and that you want to learn more, and you want to and realize that this is probably one of the last times you're actually going to be taking care of a really complex medicine patient. And even though it was hard hours and seeing a lot of patients with COVID, and for me personally, it was great being able to take care of Spanish-speaking patients that I thought I wasn't gonna be able to see too much of leaving South Texas. But I can say that I took care of a good amount of patients that were Spanish only speaking to their families was great, and it really resonated with me that I could be far away from home and still be able to take people that have similar culture to me, speak similar to me, and it was great.
Yeah, that's awesome. What are you on right now?
I'm in pediatric otolaryngology at Children's Mercy. So I just finished my first of 2 months there. So we do 2 consecutive months of PT and T during that time.
Yeah, and I mean, from what I've heard, that's a really great rotation as an intern too, because you get to start doing some of these bread and butter pediatric cases and kind of getting that graded autonomy, which is really, really nice in residency. And for me, so I spent my first month doing a month of general ENT, which we basically do 2 months of general ENT as an intern, one at Truman Medical Center, which is in Kansas City, Missouri, which is kind of like the safety net hospital, the county hospital of the entire city of Kansas City. So first month, it's a lot of general ENT. We do about 3 days of clinic, 1.5 days of OR, and you're there with a PGY4, so it's really nice to have that person to kind of guide you through that first month. And it was really nice. I mean, Truman is a very diverse patient population, a lot of Spanish-speaking patients, a lot of patients who come from areas that don't have great transportation access. Kansas City, Missouri can be a tough place to kind of to understand the medical systems there. So patients, you get a lot of complex pathology as well. And so it's a really great experience as an intern, because we spend basically 1 month there as an intern and then 3 months as a fourth year at Truman. And it's a really interesting experience where you get really good kind of clinic working up patients for general ENT problems. You get to use the microscopes, you get to practice scope exams, all of these kind of things that really are helpful throughout your residency. And on top of that, you're working with a patient population where you really get to see kind of the social determinants of health at play, and really kind of the barriers that a lot of these patients face in terms of getting access to some of our specialized care. And so we have 2 faculty that rotate there, and you're constantly able to talk with them in clinic about, the problems with the insurance system, kind of the patients you're seeing. They do a lot of teaching, and it's a nice experience, and it's a good introduction to ENT. And then now I'm on neurosurgery, which is nice because we work closely with neurosurgeons throughout our training. And again, like Pompeyo said, there's a high regard for the ENT department, and even within the neurosurgery department, they really do value our participation in their service and really help us try and learn how to manage their patients and really get comfortable seeing consults, and they're very open to us joining them in the operating room and getting that experience.